Each of the participants in this panel discussion is going to speak for 7 minutes, and then we're going to have a Q&A, and please keep feeding your questions in as we go. Maurice Swanson is Chief Executive of the National Heart Foundation of WA. Ricky Burges is the CEO of WOLGA, the WA Local Government Association, and Wendy Casey is the Director of Aboriginal Health at the Department of Health WA. Please welcome them. Maurice, over to you.
Thanks, Mary. Thank you everyone for the opportunity, and I would like to acknowledge the Indigenous owners of the land on which we're meeting this morning and pay my respects to the elders past and present. So just to start off with a couple of famous quotes, one of which was mentioned by Jane: "No single strategy will be effective and overnight success takes time." Professor Mike Daub, 1911. And for those of you who know Mike, he looks remarkable for 107. Another great quote: "Public regulation and market intervention are the only evidence-based strategies or mechanisms to prevent harm caused by the unhealthy commodity industries." Professor Rob Moody in 2013. He made that quote before the evaluation of Live Lighter was about to be published, and you'll see that number of publications have now been covered by peer-reviewed journals of the impact of Live Lighter. So if I leave you with only one message today, it's that if we're going to make any impact on obesity in this country, it has to be a comprehensive approach with evidence-based strategies and not look for a magical silver bullet. There isn't one. And I'm focusing here on a couple of things that the state government can do, and I'm going to go fairly quickly because Jane is psychic. Either that or she hacked into my computer system overnight and looked at my PowerPoint. So here are the 5 policy actions for obesity, and I'm going to go through them in serial order, and Jane's touched on a few of them. So sustaining high-impact, effective campaigns, and we have one in this state that's now been licensed for use in several other states of Australia and territories. And that was the opening outdoor billboard advertisement that we scheduled at the beginning of the campaign in Leederville, which had an amazing impact. But high impact, sustained, well-funded campaigns are absolutely essential if we're going to do anything about obesity, along with the other strategies that we'll talk about. Jane mentioned the lack of health and well-being considerations as part of our planning codes and regulation. So in WA we have a history of communities rising up against fast food outlets: Margaret River, Applecross, Guildford, and none of them can have the desired outcome on the basis of health and well-being impact, because those considerations are not in the planning codes, and that needs to change. We also need a comprehensive walking and cycling strategy that promotes active travel, and my colleague Trevor Shilton provides this famous quote: "Drive, walk, bike or bus, the choice looks simple to us." And Trevor did some fantastic work in showing how many people can be moved around a city by various modes of transport. He also makes the point that in the second most dangerous country in the world for gun deaths, Bogota, they've done it. Because we're often told that these system changes are very difficult. Well, if they're so difficult, how can this country have such amazing successes in moving people in these forms of active transport? Jane touched on this as well. We do need to restrict the availability, sale of sugary drinks, and in terms of WA, The obvious fertile areas are state-owned and operated assets and events. I'm looking at Roger as I'm speaking, as well as at the screen, including hospitals and other health facilities. Work with the facility retailers to decrease the availability of these products. And as Jane mentioned, the work in Victoria shows that when you work with the concession holders in these state-owned assets, they don't lose turnover, especially if you engage them in the planning and implementation of the objective. Now here's a ripper that Jane has referred to, and I'm just going to add a little bit of colour to this. So here's the Australian Beverages Group's criticism of our esteemed minister. I think they referred to this august meeting as a sickly summit, and that wasn't surprising to anyone. I hope you all saw my quote in the West Australian. I'll give an award to anyone who can repeat my quote. Yeah, thank you, Terry. So when we launched the sugary drinks phase of the Live Lighter campaign a couple of years ago, the Australian Beverages Council wrote to Kim Hames, the then minister, complaining about the lack of evidence that underpinned this campaign. And luckily for Kim, he just referred the correspondence through the health department to me to answer. So I had a very good time, a humorous time, writing this letter where I asked Jeff Parker, on behalf really of one of his major and most important members, Coca-Cola, could you please provide evidence published in a peer-reviewed journal that proves Coca-Cola is happiness? And of course, I got no reply, but that's not surprising. So these front groups are simply there to prevent us from doing anything that's effective. They lobby ferociously at the federal level, and it's not therefore surprising that these regulatory changes are so difficult to achieve, but they're absolutely necessary. Jane touched on the ubiquity of marketing and advertising to kids. It is everywhere. McDonald's is the leading operator in the world of digital marketing to children. And I asked the question, do you really want Ronald McDonald to be the chief nutrition advisor to our children and adolescents? Well, I think the answer is simply no. But McDonald's has an amazingly good range of corporate strategies. Dare I mention, because I'll get stoned and hung, drawn and quartered, that what a brilliant strategy Ronald McDonald House is. I mean, who would argue about providing emergency accommodation for parents when their kids are sick? Not even I would argue against that. But whoever dreamed up that as a corporate relations strategy should be given a very large bonus. I'm sure they were. So we need to do something about advertising and marketing to kids, and most of those regulatory changes would need to be a Commonwealth and state combined activity. Jane also touched on, as she hacked into my PowerPoint, self-regulation. Self-regulation is an absolute failure. It's written by the industry, for the industry, so that it's guaranteed to be completely ineffective. But look at the happy faces there that were involved in that formulation. It's wonderful stuff. So restricting children's exposure to unhealthy food advertising, I'm not going to read every one of those dot points. You can read a lot quicker than I can say the words. But we do need a comprehensive approach, and a key component of this is taking the regulatory stick to reducing exposure to junk food marketing for children. And finally, this is a great quote that I stole from Mike Daub, but he doesn't realise this. More deaths will be prevented by decisions taken at the cabinet table than at the surgical table. And Sir George Godber who was the British Chief Medical Officer for many years, made this statement, and it's a fantastic summary of what we need to denormalise overweight and obesity and start to put downward pressure on the current prevalence trends. Incidentally, Sir George lived till he was 100 and he nearly looked as good as Mike does at the moment. So some great steps in the last week, not only with this summit, which is not sickly by the way, it's very positive, the release of the Sustainable Health Review's interim report, and it was just so positive to see that one of their leading priorities was keep people healthy and get serious about prevention and health promotion. And in getting serious, if I can just reiterate, we need a comprehensive approach, we need evidence-based strategies, we need joined-up thinking, not just in the health department, we need it across government. And if we can get a whole-of-government KPI on obesity with a comprehensive policy that lists the strategies that are going to be given not only funding but priority, then I think we've got a chance. Thank you very much.
Thank you so much, Maurice. Ricky Burges, CEO of Volga.
Oh, thank you so much. I want to know why you kept looking to me every time you talked about planning. I don't know.
Oh, you don't know? No, I'll keep it for you.
I don't have any slides, but look, thank you so much for the opportunity to be here today. It's my pleasure to be able to represent, if you like, local government's interest in this question. It's such a big question and such a big issue, and it was really rewarding for me to hear Jane's comments about working together. And I thought that sectors working together is really the answer. We know that the issue, working alone is just not possible. We know that there's such huge funding issues, and we've all got that. It's not in the area of just state. I mean, local government suffers the same thing, and we're all struggling to find ways to make things work. And so mine's a fairly simple message here today. I will give a couple of examples, but the very simple message is that local government's a conduit. It's an enabler. And if we are able to work together and collaboratively on these issues, I think we've got a far better chance of getting some successful outcomes. And I know at the moment, for instance, there is a state government, local government partnership, and the Department of Local Government is demonstrating some very effective ways of enabling us to achieve more than we could possibly ever have done, either one of us working alone. So I just want to put that to you, and I'll give you some examples of how that comes about. For me, working as the CEO of a peak body, it is engaging with our local governments, and it's great to see we have a couple of our CEOs here today from Armidale and Coburn. I'll talk about perhaps an example from Wanneroo that started in Coburn that's a really good example of how we can all come together to make these things a reality. And so that's a good place to be in my role as CEO there. But I'm also on the board of Healthway, which is fantastic. Great to see some of our board members here today. And also on Mercy Care. So I have a passionate interest in health, but seeing the experts here, that's not my job today. It's just really to talk about local government. One of the things that there exists in local government is something called a strategic community plan. Now, the good thing about that is that this is legislated. There is a requirement for local governments to do that and to have this. And so that enables them to connect with the community, to talk about what the community is interested in, to talk about a community's long-term vision and their aspirations, the values. And so, as we've already seen, the community supports healthy living. mums want this, and they're a big voice out in the community. So it is something that local governments work with, and it helps them develop what's called a community profile, if you like, and it's the basis that they use for planning, for programming and reporting. And so perhaps you're saying, well, what does that actually mean for me? I'm not in local government. This plan is what local governments use to engage with their community, as I've said, and it enables those voices to be heard, and it begins the process of perhaps developing and forming this plan. And that sets the tone for the plan for the next 10 years. So it's a great point for everyone to be aware of, and to perhaps an entry point to get in and work with them on what is for the common good in terms of health and benefiting local communities. There are 3 things that local governments do all day, every day, and those things are about policy development. The peak body, WELGA, works on policy development all the time, and so we're intensely interested and acutely interested in what's happening in the health plans of Western Australia. Local governments every day in their own areas are working on policy. Infrastructure and creating supportive environments, and so we heard comments about planning, and that's a critical point of local government's responsibility, and programs and services that assist and support positive health behaviours and decisions. So when those components, those 3 things, there are lots of other things, but particularly those things, when they're working together, they can create great spaces and places and reflect policies that encourage good behaviour. And perhaps when I speak of the exemplar of your move, Wanneroo, I'll say more about that. So the Public Health Act and public health planning includes processes that impact on health and wellbeing outcomes, and related processes that allow the development of a local government response. And as I've said, I can't see how into the future, working alone and working in absence of each other, this joined up approach that we talk about, unless we are able to get over the sort of isolation and the silos that we work within, unless we can overcome that and work together, I can't see how we're going to go forward. So for me, that's a very big issue. So this business about it in practice, so prevention, promotion, partnerships, working together, that working group, we had some exemplars presented there, and as I mentioned, I think it was 2013, 2014 in Coburn, they started this process about Your Move Coburn, which led on to Wanneroo doing this. So just to give you an example so you can hear and understand what I'm talking about, it was an innovative physical activity and active transport behaviour change, this project that was managed collaboratively by the Department of Sport and Recreation and the Department of Transport. And this Your Move Wanneroo program integrated the most successful elements of Transport's Travel Smart program and the Sport and Recreation's Active Smart program, and it applied sophisticated and informed behaviour change methodology, offering individualised active lifestyle coaching, transport infrastructure upgrades, community services to households, schools and businesses within a local government area setting. Partnering with local government in a defined area was a key to success to the ongoing sustainability of behaviour change and this particular project. So using local government strengths in policy development and infrastructure planning and creating supportive environments, it's essential to this sort of program model. So Your Move Wanneroo in the city of Wanneroo from April to December 2015 was offered to all 64,000 households with a recruitment target of 10,500 households registered. The key objectives for the project were to increase the level of physical activity, increase levels of participation in local sporting clubs and active recreation groups and programs, increase the number of car trips swapped for active modes of transport such as walking, cycling and public transport, and increase community connectedness. The take-home success points of this project model that are relevant for today's discussion: collaborative effort between state government, local government, not-for-profit groups. Also, high level of service unit involvement across the city of Wanneroo, involving 9 of their different service units. So there was a behaviour change approach. It incorporated proven behaviour change principles, and key principles of behaviour change included goal setting, localised personalised information, social motivation, support, connectedness to community, cross-community projects, schools, workplaces, 2 tiers of government, and that was also aligned with active transport infrastructure and programs, vouchers, HBF fitness, bike workshops. So this was all critically important to the outcome. Ongoing healthy public policy development. It continues to support good decision making both within and external to that city, and it creates sustainable, supportive components, environments and behaviours. So how do we know that that worked? How do we know that it was a success? Well, we know that because they surveyed the residents, and in evaluation there, the responses that came back were with regard to physical activity and improvement in that, active transport use, awareness of those programs, facilities and parks in the city of Wanneroo and the community around there, and awareness of infrastructure, that is things like wayfinding signs, bike repair stations, etc. So local governments are your conduit. You can use them. You can develop programs and these processes and use local governments to connect and find your way through to better outcomes. It doesn't matter where you are in Western Australia, there's a structure that can ensure consistency in delivery. That's through the strategic community plan, through public health plans, collaborative partnerships. Local government's a conduit that can connect you, and local government's intensely focused on being responsive to their communities. When they're not, we see what happens. Unfortunately, it's in the media every day, in fact today. And it also, of course, includes their health and wellbeing outcomes. So, as I said, local government is here waiting and wants to be connected and work with you. Thank you.
Thank you very much, Ricky. Wendy, you might want to just... Wendy?
Yes.
You might want to just bring your microphone around in front of you a bit more.
Yeah. How's that?
Please welcome Wendy Casey.
Thank you. First, can I also acknowledge the traditional owners on whose land we meet, the Whadjuk people, and pay respect to my elders past and present. I'm a bit out of my comfort zone, I have to say. I'm not a specialist in obesity, particularly according to my BMI. But I do know a little bit about Aboriginal health, and I guess that's why I'm here. I had an interesting conversation with a former colleague earlier on who reminded me of when I ran out of a conference once with a lapel mic on, standing outside going, why the beat was I invited to this? But I can actually quote that this morning on the ABC radio, I was quoted as saying, how excited I am to be here. And I really am, so let's move on. Let's start to contextualise from an Aboriginal cultural perspective around obesity. And the only place we can start with is life expectancy. We know that our people in Western Australia for men are 15.1 years lower, and women are 13.5 years lower than non-Aboriginal people. And a lot of what contributes to this gap is obesity and chronic disease management, or chronic diseases in general. We also know we're slightly higher, obviously, than mainstream West Australians, but about the same, around 67% of Aboriginal people living in WA are obese or overweight, and about a third of our kids are considered overweight or obese. So these issues are concerning, and overall we're about 1.6 times more likely to be obese than non-Aboriginal people. We know that chronic diseases play a large part in Aboriginal life expectancy. We know what the different conditions are that you can get for being obese, but for Aboriginal people, the rates of these chronic diseases are much, much higher. Diabetes, end-stage kidney, cardiovascular disorders. We have got big issues in the community. We also know that chronic diseases are responsible for around 64% of the total disease burden for Aboriginal people. And that's about, 2.8 times higher than for non-Aboriginal people. But more importantly, and it's already been discussed this morning, around the social determinants have a huge impact on the Aboriginal community. We have overcrowded housing. About 24% of our people live in overcrowded housing versus about 4% of non-Aboriginal people, and the rates are much higher in remote areas. We have very high rates of unemployment, and our kids are behind the 8 ball in terms of getting Year 12 attainment, although that has been improving. Evidence is emerging. If we can get our kids to finish Year 12, then we're going to really improve health and wellbeing outcomes, and their children will have a better life. We also know that 37% overall a burden of disease could be avoided if we reduce these risk factors in the Aboriginal community, including high body mass, physical inactivity and poor diet. So there's some of the evidence. But what else do we need to know? And maybe a bit of a focus first on what traditional life was like for Aboriginal people before colonisation. Our people worked collectively, we looked after each other, we looked after our country, we had sophisticated knowledge of the seasons and securing our own food supplies. And we also know that traditional foods were very high in protein, low in sugars, high in micronutrients and high in complex carbohydrates. So our food base was very nutritional. Hunting and gathering is really hard work. Lots of activity and people had a role and function in life. So our fitness was maintained and we had a purpose. Our lian was strong, lian being a Yawuru term for well-being. And when your well-being is strong, it means you're connected to your family, community and country and culture. We took only what we needed. There was no opportunities to overeat. We made sure that we had rituals and ceremonies that kept our country alive and ensured a good food supply. And that seemed to work pretty well for thousands of years. But we know the impact of colonisation's had a huge devastating effect on the health and wellbeing of Aboriginal people. And very briefly, if I can in a minute, we had legislation that took over Aboriginal people's lives, dispossessed us from our country and even took away our children. And there is a historical element to understanding nutrition from an Aboriginal context. A Western diet was imposed, and it wasn't like they were skipping along giving us a nice basket full of fruit and vegetables. It was probably the staples that aren't very good for us, and they were often used as payment for very, very hard work. So flour, tea, sugar, salt, all was imposed. The overall dependence during the colonisation phase, that we had to start to rely on the dominant culture because we weren't allowed to practice our own ways, has actually led to some of the issues we see today. Roles changed dramatically for men and women. Women were no longer able to feed their children in the ways that they always have. That's provided that their children weren't taken away. So today we can look at obesity as being one of the past and present unintended consequences of oppression. Disadvantage in general is very complex in Aboriginal communities. That's already been spoken about this morning. We have, and we need to, no one single solution is going to actually, we need to be doing multiple things to make a difference. Often you hear about what the cause is from a biological medical type model. Used to get this a lot when I worked in the drug and alcohol field as well. And no one wants to minimise medical biological models, but I think we really need to look at obesity through the lens of environmental factors in our community and the accumulated effects of history. We also know that getting good quality food up into remote areas sometimes can be a bit tricky, particularly when the whole area is flooding, as it has been in recent times. And we also know that we need fresh food to be affordable for our people in communities. I guess obesity has to be seen as part of disadvantage overall for Aboriginal people. So what do we need to do in terms of strengthening the cultural determinants of health for Aboriginal people with a prevention lens? Now, the cultural determinants are really important. I spoke earlier about the social determinants, which are usually the negative impacts that have on health. The cultural determinants are actually the things that are strengths-based and how we can start to build further resilience in the community. Culture must be central to prevention initiatives targeting Aboriginal people. Aboriginal community control, engagement and leadership is absolutely critical to developing local-based solutions. We need to ensure that individual, family and community responsibility, where people are engaged and respectful of the need to be accountable as a collective for Aboriginal health and wellbeing. Caring for country is really important, and participation in cultural activities is really important. one feeling or working together. And in Ingrid's words this morning, in the spirit of reconciliation, we need a collective approach to improve Aboriginal health and wellbeing outcomes.
Thank you, Wendy, so much. Let's stick with that thought, though, in terms of how we can come together as a community, because that was really a theme in all three of your presentations. And there are a couple of questions that have come up that are to do with resourcing. So I'm going to ask both
to think about it further if something comes up.
Can I add, I think it's really essential that the there are some parts of the metropolitan area that are not high-income areas where they are loaded with fast food outlets, and they know what they're doing. They're targeting those populations that are least able to resist their marketing and their pricing. From Jane, that the majority of people want to do the right thing by their families. They want to do the right thing by their kids. But we're undermining that motivation by not assisting them to change the environment in which they're making those choices. So there's a huge amount of work that we could do to make the environment
agreement and support from me on that issue. The planning issues continue to knock on that inroads. And interestingly, in our own organisation, not necessarily in councils, but in our own organisation, it is the community unit and the planning unit that work together because they cross over so much. And this is, as you say, a huge issue. We recognise it and we're continuing to try and influence and make some inroads. And I think that there are two things. Poorer groups and sort of situations are having the marketing focus put on them, but it's also, and I know from personal experience with my own family, one of my sons and his wife are in that sort of situation, and sometimes the only thing they can do and the only thing they can afford is a McDonald's. Their gift in a way, which I heard Jane talk about, it just breaks my heart. But so I understand what you're saying.
It's hard to understand when you talk about something as simple as just changing the planning laws. That, I mean, how difficult is that?
Very.
Why? Why is it?
Look, it would take me too long, and there are so many vested interests and different groups that are involved in that. And even when you get it right, people object and it goes to another body to overturn. I mean, it is a very complex area and I'm really not qualified to answer that. Thanks.
Wendy, is there already collaboration with local governments with Aboriginal communities to address some of these health issues?
Certainly in different areas, and some work better than others, and you do find in the sort of more regional areas that there's quite good working relationships. Councils employing more Aboriginal people as well to work in this space is really important.
Could I answer?
Yes.
Just one thing I'd like to say. Local government has teamed up with Main Roads and we are involved in a small group called Nudge. I don't know if you've heard about them.
Sorry, which group?
Nudge. They used to be Roads Foundation, and their reason for being is to work with Aboriginal youth and create opportunities for them to get work in local.
Urban design to support healthier lifestyles and bring people closer to knowing their sources of food and getting active. Maurice, have you got a strong view?
Well, I think there's a trend in the community, or at least in those in middle and higher incomes, towards fresh food markets, local markets. Of course, I've got imagine that Coles and Woolies still provide the bulk of fruit and vegetables to Australians, but there's certainly a trend in buying produce from those sorts of outlets, and many of the providers provide that link to where the food is grown. And I think that's encouraging. I think it's a good sign. I don't think it's the complete answer, but it would be good if we could harness the Coles and Woolworths. I know there are other players entering the market now, but if we could get them more focused on health rather than flogging rubbish and marketing it with great skill at end of aisles. When I walk around the supermarket, every end of aisle promotion is absolute crap.
Educate about nutritional foods and so on, and they include some, traditional foods and bush medicine and those sorts of things as well. And people feel really good when they grow something, grow your own. They used to say back in the 70s. Anyway, I'm not here for the alcohol and drug session.
That's for another summit, Wendy. Because I was reflecting when you were talking about the tragedy of the lost traditional life, and how what's interesting about this story and the opportunity with really turn things around. Is that me imagining things? Or?
No, absolutely. There's some really good examples out there of in traditional hunting, gathering, if you like, and sharing that with the children, and some of the bush fruits in Aboriginal communities are amazing. Like there's a little bush fruit from where my mob are from called gubbinge that's got one of the highest sources of vitamin C. I mean, this is really nutritional food, and people are doing well. It's hard to, with the data, not everyone's doom and gloom. But we can't ignore those who are.
There's a question about education for and about healthier living is mandated but not prioritised in schools. How can we get a better match between schools and action? Maurice, I feel like education is your department.
Well, thank you for handing me the grenade. I would caution that we need to focus on just one strategy. I think, if anything, there's been a drop-off in the emphasis on health promotion, health education in schools. We used to lead the country, the nation. We used to lead the world in that regard. But I think, unfortunately, with the pressures on schools to teach everything, every topic known to man, that priority has dropped off. In fact, we even used to have ACHPA running a survey every couple of years to measure what was being taught, how much was being taught, what teachers were involved in the teaching of health. That seems to have gone by the wayside many years ago. So I'm not confident that placing all of our eggs in that basket is the solution. I think that we need to improve it, certainly, but it needs to be part of that comprehensive approach that I was talking about.
Exist.
Look, absolutely, definitely, we have to remain engaged with the Aboriginal community, consult with the Aboriginal community, and have leadership coming from the Aboriginal community. They're critical principles in the way we should work, and we need to all be doing that not just the Aboriginal Health Policy Directorate from the Department of Health, but across health and across other areas need to be doing that work, like local council and so on as well. Absolutely critical. Aboriginal people actually do know what we need, and we need to be supported in being able to do what we need to do in partnership and collaboration with the broader community and with the resources to do that.
Mary, could I just add one other thing? While I've been sitting here, I've got 3 messages on my phone. One was to stand up, the other one was to quieten my mind and shut up, and the third was an ABC News alert regarding the recall of Takata airbags, which is a current story at the moment. They have caused 1 possible death in Australia. 1. And they're recalling 330,000 cars because of the potential risk. And we've got an obesity epidemic, and we're all sitting here and saying, oh, why can't the government pass this or that regulation? I think it's just incredible, and it just shows you how we've got to get a lot better at our advocacy to government in a combined way to create some change here.
That's an extraordinary way to wrap up the session. Thank you very much.